Okay, thank you, Maureen. So as Maureen mentioned, I'm on faculty in biomedical sciences at the medical school in Duluth, and I absolutely love it. Before we jump into a lot of description about the project and some background, I'm going to give you a little bit of background on myself and how I got to be involved in projects such as Oshkii Ayaawag. So I'm of Ojibwe and Finnish heritage. I grew up on the Iron Range near Embarrass, Minnesota, if everybody knows or anybody knows where that is. My home tribal community is Bois Forte, and this is the community that I'm collaborating with on this project. Okay, so where I grew up near Embarrass is about 15 minutes or so away from the area of Bois Forte that I'm affiliated with. So now as a teenager, I became involved in programming for Native American youth at the medical school in Duluth. So the involvement in these types of programs followed through to both my undergraduate and my undergraduate programs, and those were just amazing experiences. So after finishing up with college, I was hired at the Center of American Indian and Minority Health at the medical school, and I worked there for about 20 or so years. And then after finishing up my doctoral degree, I moved on to faculty um, and began to develop some of my own projects, such as Oshkii Ayaawag. And so at present, there are actually multiple projects that are going on. So now back to Oshkii Ayaawag. Um, so Oshkii Ayaawag is funded through 3 grants. One is a medical school grant that's intended to consider ways that we can work to reduce racial and ethnic disparities in healthcare in light of COVID-19. So with this opportunity, I chose to focus on creating a partnership with Bois Forte, which of course, as I mentioned, and Bois Forte is an Ojibwe band in Minnesota. The area that we decided to focus on for this project is the impact of COVID-19 on the mental health of Bois Forte adolescents. So with that, the presence of COVID-19 has led to a reduction of or loss of access to many of the mental and behavioral health supports at Bois Forte. So what we decided is that in order to accommodate COVID, we'd like to create a virtual mental health support model for the youth and try to help fill some of these gaps in services. So our hope then is that after this 1-year grant period, we'll be able to continue to offer this service, this support system to the adolescents at Bois Forte. And so we'll move on to a little more information about the project. We might well get done here a little bit early, so everybody might get a chance to go to lunch here earlier than they had thought. So to start us off, I'd just like to take a few minutes and talk about some of the important things that we really need to take into account when we consider Native American health. First, it's really important that we put Native American health into context. Many times when we consider health status, what we are welcomed with is large quantities of statistical information that is based on individual behavior or diseases. But the thing is, if we focus too much on the statistics and individual, what can happen then is we can slip into a real trap of otherness. So for example, if we see that tobacco use rates are higher in among one race or ethnicity than another, then with that, we've already sort of set up that us versus them scenario. And then additionally, when we rely too much on statistics, we're really very easily led to overly focus on the individual and the individual behaviors. So what happens then is, again, we can just slip into this idea of looking at people with a deficit view. And so what that means, or what I mean by that, is we look at them as having deficits. So we might find ourselves sometimes blaming the person because of their own shortcomings, or maybe their character flaws. So while we do need to take individual information and individual choice into consideration, we also need to let ourselves reframe some of this and look at how some of the systems and institutional norms impact health. And so recently we've heard a lot about structural or systemic racism. And so this is kind of what that's all getting at. So if we allow ourselves to look at those systems or structures or institutions, then as a result, we can begin to really dig into those things and affect positive change in health outcomes. So then what this means is when we think about health, including Native American health, we really need to step back and keep this larger picture in mind and really try our best not to focus solely on the individual, but and see the individual as one component of the picture. So there's a number of factors that we also need to take into account when we think about Native American health outcomes. And these are all related to those structural factors that we were just talking about. So when we think about Native health, we also need to think about a very long list of very complex, interwoven factors that have a real impact. And this includes, but certainly it's not limited to, things such as historical trauma, intergenerational trauma, adverse childhood experiences, poverty and socioeconomic class, and culture loss. So in terms of the types of structures that we just talked about, some of the things that are behind these factors that we just named are things like destructive federal policies regarding Native Americans that began way back hundreds of years ago and have continued to the present. And when I say the present, there's still things there. But just as an example, Native Americans, it was not legal for Native Americans to practice their own religion or take part in traditional ceremonies until 1978. So this is an example of one of those structural factors that really does affect the Native American population health. Okay, and of course, all of these factors that we just looked at here have been exacerbated by the presence of COVID-19, and that's not surprising. So now we'll just start to sort of hone in on the focus areas of Oshkii Ayaawag. So I mentioned, Oshkii Ayaawag focuses on the impact of two major Native American health concerns, and that's COVID-19 and adolescent mental health. So first we'll just kind of look at this using a statewide lens. So in Minnesota, COVID-19 has disproportionately affected or impacted Native Americans. And so you can see that the hospitalization rate of Native Americans is much, much higher than whites. And the death is also much higher than the deaths rates of death among the white population or within the white population. But when we think about these rates, there's a couple of things that we do want to remember. So there's rates that we see in reservation communities, and these are not the same as rates found among people who are living outside of the reservation boundaries. So many reservations, because of their authority to enact certain measures because of their tribal sovereignty, they found ways to really keep the cases of COVID down in many instances. However, the majority of Native Americans in Minnesota do not live on reservations. And so the effect has been much different and much more detrimental. And so that's why we see these higher rates. So then when we think about these higher rates, one of the questions we might ask ourselves is why? What's leading to these higher rates? What are some of the barriers to healthcare? Well, one of the answers is related to something that many of us are already familiar with, and this is the issue of access to care. And things that contribute to this in the Native American population include poverty, people who are uninsured or underinsured. There may be an overall lack of or inadequate health services. And then, of course, there's always the issue of cost of care. And these are just some very simple examples. However, in addition to these familiar access to care concerns, Native Americans might also avoid or delay seeking care until their illnesses are really pretty advanced. And there really are some reasons for this. One of these includes historical trauma and infectious disease. So some of us may have heard about the effect of the introduction of smallpox on the Native American population, and how this really devastated and actually wiped out entire Native communities. So smallpox is not the only infectious disease that has been detrimental to Native communities. There's other things like measles and influenza that have really had just terrible outcomes on the communities. So now the thing is too, this is a very real fear, but it's also a very real reality even today. Excuse me. So as recently as 2009, with the outbreak of H1N1 influenza, Native Americans actually died at 4 times the rate of whites. And so we can see that it is not something of the past. Another factor is distrust of institutions. Again, because of past and actually continued unethical or discriminatory practices regarding Native Americans, there's been this creation of distrust of institutions, and this distrust extends to healthcare facilities. So that can be a factor. Another part of that distrust is that people may have received minimal or inadequate care when they've attempted to access healthcare. So that kind of deteriorated their trust of health facilities or healthcare providers. And then another thing, of course, is the whole issue of discrimination and racism. So discrimination and racism in the healthcare system is not a thing of the past. It continues today, and it's very real. Native Americans continue to have harmful experiences when they receive care. So as a result, sometimes there's an avoidance of care due to a fear that this is going to be something that they'll be exposed to. So now I'm going to make the switch from COVID-19 over to our other area of health, and that's adolescent mental health. Excuse me. Get a drink of coffee there. So in Minnesota, there's higher rates of mental and behavioral health disorders among Native American adolescents. However, as you can see from the information here, Native American adolescents in Minnesota are the least likely to be screened for something like depression. And they are also less likely than their white peers to actually receive mental health treatment for their disorders. So this is a big concern. And again, there are multiple reasons and that we have to take into account for why Native American youth don't receive the mental health care that they need. And so there's the familiar lack of access to care, the same sort of concerns about having experienced racism or discrimination in receiving care, or a fear that they will experience racism or discrimination if they seek care. Similar to what we just talked about, youth may not trust providers or the care facilities. And then of course, there's also the continued stigma that is attached to mental health disorders and the seeking of treatment for them. And then finally, one of the issues in treatment of Native American adolescents, and this is actually true for adults also, is that there's not a strong presence of culturally congruent care. And this is an absolutely critical factor in providing effective care. So here I'm gonna move on and start talking about the impact of COVID-19 on the tribal communities themselves. And so when we're looking at this, what I'm talking about is, remember I said that there's reservation communities, and then there's communities that are not within the boundaries of the reservation. So what we're looking at here are the reservations specifically, and this does include Bois Forte, the collaborator on this project. So the effect of COVID-19 on tribal communities has been disproportionately hard. So what this includes are things that have been experienced. What this means is that those sorts of things that have been experienced by other communities are sort of magnified because reservations are kind of a microcosm and include their own systems of government, healthcare, sources of revenue, and on down the line. So essentially, the effect is different. And additionally, in tribal communities, even under the best of circumstances, most communities are critically underfunded in regard to their services and the infrastructure, okay, of their communities. One of the issues in terms of revenue is that, and in jobs, is that gaming and tourism industries are, for many communities, the major sources of revenue. So with the emergence of COVID-19 and the stay-at-home orders, these were lost. So entire communities then were placed on furlough or lost their employment altogether. And some remain in that circumstance. And then in addition, essential services, including health services and social services, were lost. School, like in many other places, were closed, and youth programming and community events were canceled. Now, in terms of community events, this is actually a really important component, and we'll talk about this more in a little bit. So the the concept of community and culture and the ability to come together, those are things that have been very integral survival mechanisms for Native Americans across history. And I'm talking about, not just the last few hundred years, I'm talking about thousands of years. So these are absolutely essential to the livelihood of Native American communities. So when we take the cumulative effect of all of these different things, what we have seen is rises in community-wide, rises in depression, anxiety, substance use, overdoses, trauma, and violence, including, for example, domestic violence. And of course, with all of these things going on, it wasn't just adults that were impacted. For any number of reasons, youth were also, or have been also impacted. So what we've seen there, specific to Bois Forte, is among the youth, there's been increased anxiety and also increased substance use. And these are very, very real concerns. So that brings us to Oshkii Ayaawag. So Oshkii Ayaawag is a collaborative project with the Substance Use Disorder Division of Bois Forte. Now, Bois Forte is one of the 7 bands in Ojibwe bands, in Minnesota, and it's located in a remote region up in the northern part of the state. And if you look at the little map that we have here, where that's circled, that's Bois Forte, and then the star is Duluth. So that kind of gets a picture of the distance that we're talking about. And Minnesota's big, so this is quite a distance. And even though Bois Forte is small and there's very limited access to a number of resources, it's very rich in culture and community. And so when I think about potential collaborations with Bois Forte, I always think about ways that we can bring forth some of that cultural and community richness. So Oshkii Ayaawag expands on some collaborative projects with Bois Forte that began in 2016, and this is the first set of projects that were implemented when I joined faculty. Now these projects are education-based science-related projects that are year-round, okay? And that's with the elementary school located on Bois Forte. So like those projects, Oshkii Ayaawag is community-based, so everything takes place at Bois Forte, and so there's no concern about accessibility, right? And all of the activities are implemented by Bois Forte community members. So that adds to the trust level and the community connectedness that goes along with all of that. And where needed, the medical school then will assist, support where it's needed, or I should say, where it's wanted. This is something that's up to the community. So in developing the project, how one of the things that we started with is the community identified the area of need, and the COVID-19 and adolescent mental health. That's what was identified. And then what we did is, as we were pulling this whole thing together, we brainstormed and collaborated and came up with all kinds of really neat ideas that are part of the project. So with that, all that brainstorming and all of that fun, my collaborative partner and I decided what we wanted to create are options for youth in dealing with the experiences they're having and that have been heightened by COVID-19. And what we came up with is this culturally based virtual therapy model to support and empower youth by helping them develop and strengthen healthy responses to stressors that they encounter in their lives. And of course, these have been exacerbated by COVID-19. We designed the program so it serves adolescents age 10 to 17, and we base that on the experience of the director of the substance use disorder division. And what we kind of figure is that in the upcoming year, we'll have about 18 or so kids participating. So I quickly alluded to the idea a little bit ago that culture and community have been the key to Native American survival and resiliency across the span of time. So, as mentioned, this is thousands of years. And so, when we think about serving Native American communities in effectively, it's absolutely essential that we tap into these strengths and create these culturally grounded approaches. So with Oshkii Ayaawag, we use this strength-based approach, and we look to the inherent strengths of Native American culture and community to aid the healing and the resiliency of the youth who participate in our project. So Oshkii Ayaawag uses what we call protective factors in helping youth to develop healthy responses to stressors. And what protective factors are those things that increase the likelihood for positive health outcomes. Okay. Some examples of protective factors that have been shown to facilitate these positive health outcomes among Native American youth include what you've seen here. So social connectedness, opportunities for positive activities and experiences, self-efficacy, cultural pride and identity, cultural connectedness, and community connectedness. And then, so when we take those protective factors and translate them to Oshkii Ayaawag supportive services, here's what they look like. Well, first we decided that we wanted to have a wide array of activities. So the kids could really find those things. So each kid could really find the type of, or the thing that really kind of resonates with them. And then also so that we can have the activities occur often enough that kids can take part as they're able. So it's not participation bound on a hard and fast once a month activity or something like that. So some examples of activities. We have a list here, but I'll fill in a couple of details here. So we'll have talking groups, and these are led by a Bois Forte mental health therapist. We have the cultural transmission and intergenerational bonding. So there's that cultural component there. And so what we're doing with that is we have community elders who are leading weekly Ojibwe language instruction. And then during the winter time, there will be storytelling led by the elders. And the reason why the winter time is that that's the time when storytelling happens. So we'll have craft therapy, I guess you could call it. And this provides healthy, enjoyable outlets that the kids can use in dealing with stressors. And of course, this also advances cultural knowledge in that some of the things that they'll do is beading projects, or making dream catchers, or other small items like that. And since this will be online, all of the supplies for any of that kind of thing will be packaged up and sent to the youth. For COVID-19 awareness, the kids will be given face masks that are made by community members. And then we'll also create informational materials that are tailored to the needs of adolescent Native Americans. And then finally, we'll have sessions on the identification of and use of traditional medicinal plants and how they can be used in conjunction with other forms of healthcare. So to make this extra fun, and in addition to being interesting, we'll include hands-on activities, and I say we will because these will happen later in the year. Hands-on activities where the kids will make some basic personal care items such as hand sanitizer, or lip balm or hand lotion out of these medicinal plants. And so this long list and whole array of menu of services provides multiple opportunities for the youth to build some of those positive peer relationships and to promote cultural and self-pride that they really do need, and some of what we identified as protective factors. So I just wanted to take a second to touch on this really quickly. So when we consider projects with tribal communities, there's a number of factors that we really need to take into special consideration and need to be handled with great care. And one of the areas where this is an absolute must is when a project includes research. And some communities have their own IRB. So for example, if someone from the university is wanting to do research, it not only has to be approved by the university IRB, it also needs to be approved by the tribal IRB. And for those communities that do not have an IRB, those projects are discussed with and reviewed by the tribal council. So there's some really important steps that need to be considered here. In particular to this project, my partner took the grants and she presented them to the tribal council. So it was with their blessing that this project moved forward. Trust is a very major concern in Native American communities, and you've probably gotten that sense from a few of the things that we've talked about earlier. And so trust is sometimes very hard won, but is easily lost. And so this includes trust on both the part of individuals and then also on the community-wide level. So we always have to keep that in mind. Another thing that we have to be cognizant of is that both the community and many of the youth have been traumatized. So the community, we talked about historical trauma and such, so and intergenerational trauma and many other factors. So what we have is a traumatized community. And then the kids, you know, they're just in a place where they are incredibly vulnerable. And so we have to be so careful with that. And then finally, Bois Forte is a sovereign nation. So that means they have the authority to determine what happens and how certain things are conducted in the community. And so again, an illustration of that is the tribal IRB, or involvement of the tribal council regarding projects. And so I'm just gonna, before we wrap up, I just wanna take a quick second and plug a couple of other projects that we have going on here. Okay, if you hear me get overly excited, you gotta forgive me here. So the first thing I want to touch on is a set of kids' activity books that with the support of my project team have been developed. So the books are geared for elementary age kids. All of them are culturally responsive and all are age appropriate, and they share information in a very fun and non-threatening, friendly way. So one set of books addresses math and science, and then another set of books addresses nutrition and well-being. So in the upcoming year, there will be additional books. There will be 3 more on the science and math and 2 more with nutrition and well-being. And all of those will be done before next spring. And these books have been very popular. They found their way nationwide and have moved up on into Canada. and they're being used by a number of organizations, including a number of schools. With these, everything is completely free of charge. Copies of the books can be requested, and we'll ship them at no cost, or they can be downloaded at the link that's shown here. And then finally, with the emergence of COVID-19, we decided that it was important to develop some really some basic information for kids that addresses COVID-19 and would help them deal with some of the confusing, scary things that were going around and are going on around them. So right now we have a set of 4 COVID-19 materials, and we'll have more coming up again in these next few months. And even though these are geared for kids, what we found out very quickly was that adults have found them really useful themselves. And also once these started to circulate out there, I was contacted by a couple of different communities and people working with different organizations, and was told, hey, we really need to have some of these so that they're accessible to all of Minnesota communities. And so because of that, all of these materials are available in the 4 languages that you see here: English, Somali, Spanish, and Hmong. And like the books, these 2 are completely free and are downloadable at the link that we see here. And so with that, I want to acknowledge the funding agencies that generously provided support for Oshkii Ayaawag. And I will say simply, miigwech. And that's it.
Thank you so much. We actually had an alumna jump in with a question. She says, thank you for your informative presentation. Years ago, I read about a difficult relationship between the BIA and our Native communities, really significant difficulties, inappropriate actions / philosophies at the BIA. Has that relationship improved, and how does this affect the day-to-day lives of our Native communities and your research?
I don't know if it's not as bad as it used to be, okay? And that in part is because in the 1970s, the federal government passed what's called the Indian Self-Determination Act. And so with that, Native Americans were able to take control of a number of things that before were completely controlled by the federal government. And so the BIA is still there, and is something that not everybody is fond of, but with the ability to have the self-determination, there's not as much of an animosity as there was at one time.
One other question, you talked about the avoidance of care for many Native Americans. Are there things that clinicians can do to help build the trust?
Sure. Okay, so we were talking about, it's really important to consider some of cultural factors. And this does not mean that all physicians need to be experts on Native American culture, but what it does mean is that there needs to be, care providers need to be cognizant of that and be sensitive to the fact that there may be certain areas that they want to think about. But at the same time, it's really important not to assume or generalize, right? Because not everybody, this isn't necessarily a factor for everybody. So it really is, it really does take an approach of being open and sensitive and willing to learn and talk and figure out how you can best serve that patient.
Great, thank you. We had one more question. I don't know if you know the answer to this, but I will ask. Is there a voting registration program in place for Native Americans to vote in this federal election?
There is. We can vote by mail, right? So there's absentee ballots, and believe me, I've been getting letters all over the place from Bois Forte. And then also, I would have to check into how exactly in-person voting is being managed, because that I'm not actually sure of. And because I'm not on the reservation, when it comes to, for example, tribal elections, for the tribal council, I use absentee ballot. So.
Great, thank you. We'll give a couple, just a few seconds rather, in case anybody else has any additional questions. But I would like to thank Dr. Wirta Kosobuski for your time today, for this excellent presentation. It's greatly appreciated. We just appreciate your time so much. I don't see any additional questions, so that will bring us to the end of this webinar.